Hello, everybody. My name is Dr. Michael Wald, the Blood Detective, and today we're going to talk about genetic risk and disease in a podcast that I've entitled, Your Genetic Risk of Disease Can Be Reduced with These Lifestyle Changes. You need to know that just because you might be genetically predisposed to high cholesterol or genetically have a problem with methylation or whatever the issue may be, that does not mean that adjustments to diet, nutritional supplements, and various lifestyle factors can help modify or modulate the expression of these, dysfunctional genes. So I'm a doctor of chiropractic. I have a board certification in nutrition. I'm also a dietitian and sports nutritionist. I have an MD diploma, but not an active license to practice medicine. I'm a life coach, and I even provide acupuncture to some of my clients. I have two offices, one in Chappaqua, Westchester, New York, and the other in Richmond, Virginia. So let's get right into this. I have many patients that are always asking me whether or not they should do these genetic tests, and there are various companies there which supply a plethora of dozens of different genetic markers. Most of them we can't do anything about, but a few of them we can, and most of those we actually can have them covered through our regular insurance. That's a whole other issue, but I just wanted to mention that to you. If you're interested in genetic markers, many of them may already be covered. You don't have to pay several hundreds or a few $1,000s on genetic markers that you can't even use. So the information I'm about to share with you today is for your education. It's not meant as a substitute for sound medical, health, or nutritional advice. So let's talk about various lifestyle choices here. So lifestyle choices can significantly lower the risk of a variety of chronic diseases, even in individuals that are genetically at risk of a higher incidence of these diseases. I mentioned a few when we opened up, like high cholesterol or problems with methylation. So a person, for example, with a family history of heart disease can reduce their risk of getting heart disease by about 50% or more with consistent changes in their lifestyle and changing their lifestyle to something healthier, which we'll talk about. That's remarkable that a simple change in lifestyle can reduce your genetic risk of dying by over 50%. And then in terms of a practical tip, get a yearly wellness exam. I would suggest with a holistically oriented doctor that has license to do laboratory tests. Regular medical exams are practically useless, but a properly trained holistic practitioner like myself uses a variety of biomarkers testing from a variety of specialties of medicine all at once and can do visual nutritional exams and regular exams and all the basic stuff like EKGs or perhaps lung function all at the same visit. And then there's certain lab tests to consider if you want to reduce your genetically high risk of cardiovascular disease, high sensitivity C-reactive protein. You'll see them as under the lab section here on this chart, ApoB and homocysteine, just to name a few, along with a detailed lipid profile, perhaps hemoglobin A1C for blood sugar. And what are some other lifestyle factors that can help improve one's overall health regardless of your genetically high risk of disease? So lifestyle factors, first of all, include regular physical exercise, a nutritious diet, avoiding tobacco, and maintaining healthy weight. If you can do those things, really easy, right? Then you're going to improve your health and your propensity for a genetically higher risk of disease. So, for example, if you were to begin a Mediterranean type diet and you began exercising 150 minutes moderately every week, you'll reduce your risk of cardiovascular disease and also diabetes. And the number one cause of death in diabetics is heart attack and stroke. So scheduling 30 minutes of brisk walking or strength training 5 days per week or somewhere around there, and following a whole plant based diet can significantly reduce your risk of not just heart attack, but also of developing diabetes. And the tests you want to consider, and I give you these tests because a lot of doctors won't do them, or they'll do them, but you have to go to several different doctors, and none of the doctors are talking. So hemoglobin A1C, that's a several week average of your blood sugar. Your glucose level that you get checked on your blood test is just the glucose at the time of the test, and it varies. You want to know the average over a long period of time, and that's what the hemoglobin A1C will tell us. fasting insulin, and a body composition. What is your lean mass? What is your percentage of muscle, water, and fat on your body? How is your body managing water? All of that can be determined, and metabolic rate, by the way, by doing a body composition test. And just so you know, regardless of what you end up doing to improve your health, let's say it lowers your blood pressure, cholesterol goes down, all these genetic things that you're predisposed to, if those things occur as you gain increased lean mass as measured on a body composition, you really truly have done something there. If you get those improvements in pressure and your cholesterol goes down, for example, but you do not have an increase in your lean body mass as measured by body composition, you have statistically not improved your potential for lifespan or improved your health span, how long you live in the non-disability stage of life. That's why you want to do body composition. You want to listen to the podcasts that I have on body composition. It's that important of a test. Epigenetics, what does that mean? So basically that means that there are factors in life like your dietary intake and your stress, air pollution exposure, for example, that play upon your genetic expression. So these things outside of you are considered epigenetic things, factors that can trigger the response of your genetic propensities. So, for example, if you are genetically susceptible to increased cholesterol levels and you are exposed to, let's say, pollution, that would also turn on the genes that activate the proteins that would tell your various body tissues, like your liver, to produce more cholesterol. So we want to modify the outside epigenetic factors so that they do not express, okay? Or they can actually go the opposite way. We don't want them expressing, giving us the disease. We want the opposite, suppression. So studies show that lifestyle can reduce the expression of disease-related genes through epigenetic mechanisms. We know that even if you are genetically predisposed to a disease, in almost every case, if you modify your lifestyle, you can improve your health outcome. Regular exercise, for example, a plant-based high antioxidant diet, can modify DNA methylation patterns in a positive way. So eating cruciferous vegetables like broccoli, cauliflower, kale 3 to 5 times a week, prioritizing sleep hygiene, all can improve your genetically poor methylation. So usually your homocysteine might be elevated. I've given you some other methylation markers here. Homocysteine and methylmalonic acid are two additional ones. If either of those are high, you probably have an issue with methylation. Almost certainly you do. You might also have an increased need for B6, B12, folic acid. And if you do, you want to take the folic acid and the B12 in methylated forms and the B6 in an activated phosphorylated form to offset your genetically poor methylation. Very important. And I will be covering this in more detail in another podcast that I'll be producing in the next few weeks on methylation. What about heart health, diabetes, and cancer? Well, for conditions like heart health and type 2 diabetes, which is the non-insulin dependent form, and cancer, a lifestyle plays a more powerful role than genetics alone. So genetics does have an effect upon your health, but lifestyle factors can affect the expression of those genetics in a major way. For example, in a very large study known as the Framingham study, lifestyle factors had a greater impact on heart health risk than genetic markers did. So your doctors might measure these genetic markers and try to scare the hell out of you without telling you, by the way, these markers can be overcome in almost every instance with proper lifestyle management. And the proper lifestyle management needs to be determined for the individual. Some people need more exercise than others. Some people need different types of exercises than others. Some people need different foods. Some may need nutritional supplements. Whatever you figure out doing, that will help to influence the genetic expression. So practical steps. In terms of lifestyle factors for reduction of diabetes and heart disease and cancer, you want to use a fitness tracker. You want to log your meals for 30 days, provide that to your nutritional doctor, and have him or her figure out in the entire context of what you're trying to do here with your health, what your food intake should be, and the best food choices and supplement choices and lifestyle choices that can most effectively have a positive impact on reducing the expression of your genetic tendencies. Hope that made sense. Some lab tests to consider: lipoprotein A, coronary calcium score, insulin resistance panel, oncogene or cancer tests. And when you take the right nutrition and modify your lifestyle factors correctly, you will see that these tests will normalize or become much, much more normal. Some tests you can't fix them all the way, but there are ways of compensating. And other tests you can fix all the way, even though you are genetically predisposed. Some other healthy habits to be mindful of. Adopting healthy habits obviously can delay or even prevent the onset of genetically influenced diseases. For example, a woman, for example, with a BRCA mutation can reduce breast cancer risk with lifestyle, exercise, and dietary modifications. Now, my personal opinion is if you are positive for either BRCA gene 1 or 2, and you are offered the choice between mastectomy and lifestyle factors, I would choose mastectomy because your risk, if you have these BRCA genes, of developing breast cancer is almost guaranteed in your lifestyle, in your lifetime. And there is no amount of nutrition which will remove that. This is the one exception that I know of. There's a couple of exceptions, actually. You should also know, a very interesting point here is that, and I wrote it here in the italics bold, 2.5 to 5% of all women carry the BRCA1 or BRCA2 gene mutation according to the American Cancer Society. Only 2.5 to 5% of women. That means that most breast cancer that we see has nothing to do with BRCA genes 1 or 2. I'm going to say that again. At the higher end, the strongest influence that the BRCA gene, the gene mutation, this is about gene mutations, can influence breast cancer predilection in society is about 5%. The other 95% of breast cancer has nothing to do with being genetically predisposed. And that, the greater amount there, has the most responsive effect on improvements in lifestyle. In fact, it's been said that most breast cancer is, in fact, from poor lifestyle and nutrition. And under the lab test here, you can check yourself for BRCA mutations. You can look at estrogen and various inflammatory markers. And there's more depending on the person's situation in terms of testing. So as a blood detective, I've determined the test that I feel that a patient needs based upon their health concerns, their health goals, what other tests may have been abnormal in the past, and some other factors. So sometimes I'm called up and someone will say to me, Dr. Wald, can't you just tell me the tests? I can get them done first and I'll come see you. I don't know. We have to talk and figure it out. What about smoking, being sedentary in your lifestyle, and poor nutrition? So we know that smoking and sedentary lifestyle and poor nutrition all activate harmful genes and increase the expression of these genetic pathways. So if you have these poor lifestyle factors, you will increase your risk of whatever you're genetically predisposed to dying from. We know that tobacco smoke has pro-inflammatory effects. Tobacco also promotes oxidative stress. And that, of course, will accelerate the aging of the cardiovascular system and the lungs and the immune system, just to name a few. So obviously, replace smoking or excessive screen time even, which also increases oxidation, I should say, in the body, with stress-reducing habits like walking, deep breathing, and group fitness. Various lab tests, I've named some of them to see the effects that tobacco smoke may have upon you specifically, and there are other tests as well. In terms of family history, people with a family history of disease benefit the most from proactive lifestyle interventions. Obviously, if you have disease in your family history like high cholesterol or hypertension or diabetes or cancer, you want to adjust your lifestyle. You're going to impact your risk much, much more strongly than doing nothing, obviously. So in terms of an example here of family history, individuals with diabetic parents who maintain normal weight and diet cut their risk of developing diabetes themselves by 75%. The amount of people that are dying from cardiovascular risk, strokes, heart attacks, and other complications of diabetes can be cut by 75%, even with genetic predisposition in the family, if you simply maintain your weight, and that's it. And then in terms of testing, hemoglobin A1C, a several week marker of a blood sugar average, your fasting glucose, your insulin, there's some other tests like leptins. They all will help your practitioner determine how and to what extent your improvements in lifestyle have impacted positively or negatively your genetic predisposition to disease. And then there's modifying behavior and chronic disease. Long-term studies confirm that modifying behavior, such as reducing your stress, can override much of the inherited risk of a variety of chronic diseases. So, for example, the Nurses' Health Study and EPIC study linked lifestyle choices to longevity despite genetic profiles. So you can have all these genetic abnormalities which say that you're going to get Alzheimer's disease and heart disease and all of that, but we know that just modifying your stress or your sleep or your diet can make these huge impacts. Back in school, I remember taking a genetics class in high school, and they said, once you have a genetic issue, that's it. That's all they even said. And when you're in medical school, they really don't say much more than that. So I've given you some lab tests to consider too when assessing whether your modifications in your behavior and your lifestyle have actually impacted what you want to impact to the extent that you need that impacted. And in terms of practical steps, you might take 3 to 5 key lifestyle metrics like your weight, what steps, how many steps you have per day in terms of your activity, your sleep hours, your stress level. And these things can be adjusted, and then we can look at your genetic expression to see if the markers of the genetic glitches that you have are reducing. People say to me, well, Dr. Wald, how do I know if it works? It will work because the genetic markers, the nutritional markers, and other lifestyle biomarkers will improve. So that's basically it for this conversation. I hope you found it useful. Thank you for suggesting the concept of genetics and how to overcome genetic issues with proper lifestyle choices. Thanks very much, and I'll see you at the next podcast.